So today I'll talk about the risk of undergoing lumbar fusion. There are different types of lumbar fusions, something called transforaminal lumbar antibody fusion, extreme lateral antibody fusion, oblique lateral antibody fusion, anterior lateral antibody fusion. Some surgeries are done from the front, some surgeries are done from the side, some from the back. Surgeries that are done from the front for fusion, the biggest risk is vascular injury to the vena cava, which is the largest blood vessel in terms of vein, the structure that returns the blood to the heart. That injury or any venous injury can be devastating. The procedures that are done from the side can cause something called femoral nerve injury, which is also devastating, which prevents a person from walking again. Although they're minimally invasive, but they're not without risk. Surgeries done from the back. Biggest risks are infection, bleeding, malposition of hardware where the screws are abutting a nervous structure like a nerve root or spinal canal, and then they would require revision surgery. In addition to spinal fluid leak and possibility of not getting better, possibility of getting worse, there's also possibility of doing wrong level surgery. That's a sentinel event. We have to double check our finding before we start the case. In addition to anesthesia related complication like death, heart attack, stroke. So again, not a comprehensive list, but some of the more common things we encounter as neurosurgeons and spine surgeons.